We always think about sports injuries happening in professional players. Is it true that it is equally common in common people who are playing these sports otherwise?
Well, first and foremost, I would say know your limitation. So everybody cannot become Sachin Tendulkar.
Absolutely.
Most of my patients are non-professionals.
So, what are the common mistakes they do while doing these workouts or running or walking for that matter? Sir?
See, it's very risky to suddenly go and do certain things. So what I would recommend is
Are there any specific sports or exercise that carry a higher risk of sports injury or?
contact sports like football, which involves a lot of physical activity. It's extremely dangerous to ignore sports-related injury. If you're not doing it in the right way, you're prone for injury. So be careful while.
Namaste everyone. Welcome to yet another episode of podcast with me, Dr. Amitabh Kulkarni. This is a platform where we try to simplify common topics, complex topics with the help of experts. Today we are diving into yet another common topic which not just affects athletes but common people like you and me, sports injury. Now, when we say sports injury, often it jumps into our mind an injury to a professional players, whether it is a cricket player, football player, or a gym enthusiast. But here is the thing: sports injuries are equally common in common people like you and me. Whether you are playing cricket match over weekend or playing football with your friends or doing some extra gym session, sports injuries can happen at all of these places. Now, what is tricky is many a times we tend to ignore this sports injury thinking it will heal on its own, or you may just spray a pain medicine for the time being or walk it off just like that. So, I'm very happy today. I'm joined by Dr. Narendra Prabhu, who is a renowned orthopedic surgeon and has been dealing with sports injuries for years together. Today, he is going to tell us what are the common reasons or common instances where sports injuries can happen. What are the mistakes people do when they are doing exercise or playing sports that puts them at a risk for sports injury? And then he is going to tell us some preventive measures to avoid such sports injuries. Dr. Narendra Prabhu, thank you very much for accepting our invitation for this podcast. Dr. Narendra, can you tell us something about your background and your practice?
Sure. Thank you, Dr. Amitabh, for having me here for this podcast. I am Dr. Narendra Prabhu, consultant orthopedics and trauma surgeon with vast experience of 30 years, out of which initial years I spent about 10 to 12 years in India, my home country, where I practiced and trained some of the students as well in orthopedics. So from there, in 2007, I came to Dubai. Ever since then, I've been practicing in Dubai here for the last 18 years and odd. So I practice orthopedics and trauma surgeries. Orthopedics is a branch of surgery which deals with musculoskeletal system. So musculoskeletal means muscles and the skeletal system. Skeletal system includes bones and joints. So I do practice orthopedics. That means I deal with diseases of the bones and joints as well, and also the muscles. So it could be infections, it could be tumor, it could be various other conditions which will affect the bone and joints and the muscles. Also, I deal with trauma surgeries, which is sports injuries as well. So many of my patients who very often come with sports related injuries who are weekend players. So in fact, I've treated them, many of them who are non-professionals rather than professionals. We'll come to that later in the part of this podcast.
We are very lucky friends to have such an experienced orthopedic surgeon to give us insights about sports injury. So let's start, Dr. Prabhu, with our first question.
Yeah.
And we always think about sports injuries happening in professional players, whether it is football, cricket, or any other game.
Yeah.
So, is it true that it is equally common in common people who are playing these sports otherwise? What is your experience?
Yeah, of course. As I said in the beginning, most of my patients are non professionals because the fact is, injuries are very common in non professionals rather than in professionals.
Okay,
Because professionals undergo vigorous trainings
right,
and their muscles are well developed. So injuries are less common in them. They are also trained to avoid injuries while playing.
Right,
So they're trained by experts. So they know how exactly to avoid injuries, how exactly to function according to their body needs. So injuries are very common in non-professionals rather than in
okay.
professionals.
So this is an interesting thing.
Yeah.
The sports injuries are more common in non-sports people, probably.
Absolutely.
Yeah,
Absolutely.
yeah.
Yeah.
So then, what are the most common sports injuries you have seen in these non-athletes or non-professional people?
Yeah. See, commonly here, Dubai is a sports enthusiast city, basically.
Right.
So many of them are playing either cricket or football or some are gym goers. Usually weekend practices. So
Right.
so they are not well trained or they're, let's say, they're not built their muscles enough, and also some of them are over the age of 30, 35 years, where professionals retire, in
Correct.
fact.
Correct.
So you would understand why they retire at this age, because
Yeah.
the ligaments get stiffer, the muscles get a little more stiffer
Right.
compared to the younger age group.
Right.
So I've very commonly seen knee injuries, that is ACL injuries, PCL injuries, or other ligaments around the knee. I have also seen plenty of ankle injuries. Ankle sprains are very, very common. And of course, the shoulder, rotator cuff injuries or other ligaments around the shoulder.
So these are the common.
These are very common. And also, those who go to the gym and suddenly they start lifting weights. So muscle ruptures are also very common here.
So this is about someone who is playing sports, probably. But I have seen sometimes even while running or a simple workout, sometimes people do develop such injuries.
Yes.
So what are the common mistakes they do while doing these workouts or running or walking, for that matter? Say.
See, if you see, as we age, whether you like it or not, the body goes through a lot of changes. Though the mind remains young all the time.
Yeah.
So
Body is not listening
body
to that, yeah.
will not listen to it. So the clock is always ticking.
Correct.
So you should understand your body has limitations. So always, even if you're a runner or just a brisk walker, so don't suddenly start, don't get over enthusiastic and suddenly start
important, yeah.
exercising. One fine day, you get up from the bed and go for, let's say, 5 kilometers of walk.
Maybe after watching some motivational video,
Exactly.
someone just starts doing exercise.
Yes. So let's say if you go for a walk long distance, 5 kilometers on one fine day, you get up in the morning and you have listened to somebody else
True.
and you want to practice. So you are prone for what is called a stress fracture of your foot.
Okay.
So those who suddenly start running can pull their muscles, hamstring strains, or it could be a strain of your tendon Achilles, or various things. You're prone for injuries. So you should always remember, when you want to start slowly and then progress slowly.
Yeah.
So don't be over enthusiastic when you get into physical fitness or any other matter related to the body.
So that will be an important message. Start slowly.
Yeah.
Don't just start over enthusiastically
Exactly.
after like a decision for whatever reason.
Yes.
And just start slowly till your body gets accustomed to it.
Yes. And then progress from there.
Yeah. So coming to the weekend warrior players, like sometimes, especially most of us are professional, and as you correctly said, some people starts after the age of 30, 35.
Yeah.
So they have free time only on weekends.
Yeah.
So they usually play it on weekends only, whether it is cricket or football or badminton or any other games.
Yeah.
So then, how risky is it just to play only on weekends for development of such sports injuries?
See, it's very risky to suddenly go and do certain things. So, what I would recommend is, as I said, start slowly and then build it up from there.
Right.
So, similarly, warm up is very, very important when you want to play weekend sports. Always warm up at least 15 to 20 minutes because your muscles would have been stiff, your joints would have been, your ligaments would have been stiff because most of our sedentary workers, we just sit and work. So our muscles are not well developed. So you need to stretch them, give them time to warm up basically, and then start playing. So don't go suddenly jump into play when you start your sports activity in the weekend.
So again, the same message: start slow and then slowly build up.
Yeah.
So for such weekend exerciser or player, are there any specific sports or exercise that carry a higher risk of sports injury?
Well, there is no specific this thing. So basically, anything which is physically demanding, like contact sports, like football, so which involves lot of physical activity.
Correct.
So you need to be fit enough to run up and down in the football field, which may be kilometer. If you calculate it, it may be in kilometers.
Yeah,
So you should know before you start, you have to be trained well or warmed up well before you start such things. So football is physically demanding. Equally, cricket is physically demanding. So these are the things. And gym, you should know when you get into the gym, it may look very simple to you, but when you're lifting weights, if your muscles are not toned, if you're not doing it in the right way, you're prone for injury. So be careful while starting football. Don't go suddenly jump into the football field and start playing.
Yeah.
You will end up with injuries.
Yeah.
Similarly, cricket. You may be playing here and there, but when you get into, let's say, 30 over or 40 over cricket match, it is not simple. You're playing in the sun, you can get dehydrated very easily.
Right.
You can also have, when you dehydrate, the muscles, are again stiff, and so you're prone for muscle pulls or ligament injuries, such things. Similarly, at the gym, I've seen many people, over enthusiastically doing gym,
Right.
and then ending up with either muscle rupture, even sometimes what we call it as myoglobinuria,
True.
resulting in some of them have ended up even in ICU.
Correct. Yeah. So that was very clear indication that don't start something suddenly. Just your body should get accustomed to what you are going to do over the weekend, whether it is a football match, as doctor correctly said, you will be running for kilometers together, which otherwise it's your 1 month's walking probably.
Absolutely.
So doing all such strenuous exercises suddenly is definitely going to put you at a higher risk. Now, doctor, many a times when a common person goes to gym or play these matches over weekend, once in a while they get injured and they may just put some pain medicine and ignore it.
Yeah.
Now, what is your take on this? Should we always ignore it or just apply some pain medicine or spray?
It's extremely dangerous to ignore sports related injuries because sometimes it may be just a partial injury. If you ignore and continue, it may end up worsening.
Yeah.
So it may turn into complete injuries. For example, there may be few fibers of the muscles which may be torn, what is called as, we call it grade 1 strain of the muscle. You may end up with rupturing the muscle if you continue to do so.
Yeah.
Similarly, ligament may be partial injury. It may be few fibers of the ligaments may have given way, what is called as grade 1 sprain. You may end up with grade 3 sprain. So always it's risky to continue that way, just spraying the pain medications and then taking pain medication and continuing.
Yeah.
So always sought medical advice when you injure yourself and allow the doctor to assess whether it is safe to continue or whether you need to rest. This could be told only by the concerned orthopedic surgeon or
The specialist.
specialist. Yeah. It's always better to sought medical advice before you continue.
So as doctor correctly said that anything that is happening after playing a sports should not be ignored, and it may start as a minor crack or minor sprain, but if you continue to exert on that particular joint or muscle, it is possible that it may turn into something more serious. So always pay attention to the injury that has happened after playing any sports or going to gym after a long time.
Yeah.
Now, is cracking or clicking in joints always a sign of something in the joints, or it's supposed to be benign thing?
Not always. See, our joint has nitrogen gas. So sometimes the clicking and the sounds may be normal sometimes.
Yeah.
But if it occurs after an injury,
Correct.
that is the warning sign.
So definitely, if something new has happened, especially after playing a sports,
Yes.
definitely it should not be ignored at all.
Exactly.
And we should be seeking the experts' attention. Now, what is the role of warm up and stretching in such cases then, like before going to a sports session or a match or any exercise, a strenuous exercise? What is the importance of warm up and stretching according to you?
It's very important, in fact. As I said in the beginning itself, it's very, very important to warm up. Because as I said, most of our sedentary workers, so we sit and work, so our muscles are not toned, our ligaments are not toned again. So you need to stretch your muscles and your joints before you resume any sports or gym, or let's say even simple brisk walks, running. So always stretch yourself first. At least spend 15 to 20 minutes. That's what I would advise.
Correct.
Especially before playing any demanding games like football or cricket, or let's say even just doing a jogging or running. Correct. So at least stretch yourself 15-20 minutes and then resume.
Yeah.
That is
So
always
warm up
safe.
and stretch are very, very important before any such session. So as a layman, for a common man's understanding, how can they tell a difference between like if something has happened after the sports, whether it is just a minor thing or something major which needs a doctor's attention immediately? So how will they get to know whether this is a simple injury or a simple common occurrence after sports, or is it something, an injury which needs a doctor's attention ASAP?
Let's say you play a sports and let's say you sprain your ankle. So if there is severe pain and swelling, always immediately sought medical advice.
Correct.
So which is a direct sign that there is something serious underneath. Yeah. So always straight away get into consulting a physician or a specialist. If it is knee or ankle, sometimes you will not be able to even bear weight and walk, which indicates even more severe type of injury. It could be even a fracture, or it could be even a complete rupture of a ligament. So there will be swelling immediately, followed by the injury. So within, let's say, within 15-20 minutes, you will start seeing a swelling progressing, which is always a sign of danger underneath.
Correct.
So that's important. Always pay attention. Increasing pain, increasing swelling is a sign of deeper injuries.
Yeah. So something, as doctor correctly said, and clearly said, that pain and swelling which is noticed immediately, you should be seeking doctor's attention immediately. Now, in spite of all this, if a sports injury happens, how long, whether it is a minor injury or major injury, if it is a minor injury, suppose, which may settle down on its own or after a few days, how long should they rest before going back to the gym or going back to the sports activities?
If it is let's say grade 1, grade 2 sprains, again, it is, as I said, it's better to sort specialist advice before you start any sports.
Correct.
But in general terms, let's say there's not much of swelling, you just felt a pain following particular sports activity or a gym activity, always rest. Minimum period is 3 weeks.
3 weeks.
Minimum.
Okay.
Yeah. So I would say, okay. And try to don't do any exercise or any stretching or anything in that 3 weeks. Just rest the joint. If any binders or braces are available for the joint, just apply that so that your joint rests. Joint rest is very important before you resume. At least 3 weeks of rest, I would suggest, before they start anything. Yeah. And when you go back, if you still feel the pain, then always sought the medical advice.
Yeah. So viewers, please understand the decision to resume any game or any gym activity is done by the specialist or doctor, and as Dr. Prabhu clearly said that minimum 3 weeks is required in most of the cases. So definitely you should not start resuming activity as soon as you have become pain free or the swelling has reduced. Always better to take the attention of the experts and then only resume your activities. Of course you can, but only after doctor's opinion. So now coming to the important part of the discussion, and that is treatment of sports injury. Now, do you see there is a difference in the treatment pattern for someone who is a professional level athlete or cricketer, football player versus someone who has visited gym or playing over weekend? Is there a difference in the treatment?
Not much, I would say. Whether it is a professional or non-professional, the treatment part remains the same. For example, if it's an ACL rupture, let's say in a professional or a non-professional who is youngster, so treatment will remain as ACL reconstruction. So not much of a change, but only minor change I would say is if it's a professional, he would like to get back to
The work
as soon as possible because that is his dailyhood. He earns money from there.
Correct.
So in such cases, what we do is we put them through a little accelerated recovery phase.
Correct.
So recovery will be a little faster by accelerated physiotherapy. But it is prone for risk again, but it's their livelihood. They always would like to get back to sports as early as possible.
Correct.
So with a minimal risk, what we do is we put them through accelerated protocol to get back into sports as early as possible.
Yeah.
Otherwise, very trivial differences between professional and non-professional.
So by and large, the treatment is same. Only difference is since professional are professionals, they want to get back to the work as early as possible. They are running through one accelerated program for this. So are there any new or advanced treatment option in this arena where for sports injury some new treatment options are available now?
Of course, sports related injuries, newer and newer concepts are coming into picture because science is advancing. Similarly, the surgeries, the treatment part is advancing.
Correct.
So we have all minimally invasive treatment methods, especially with the scope advancements. It becomes easier to treat these injuries by doing what is called as keyhole surgery or arthroscopic surgeries, which is a game changer in treating sports injuries. Yes. Even when it comes to muscle injuries, there are advanced techniques. We suture the muscles through minimally invasive techniques. Like for example, tender Achilles injuries, we have what is called as PARs, where we just percutaneously pass the sutures. We don't put long incisions and treat it with a minimally invasive method so that the recovery is faster.
So, discussing this newer treatment option which you just mentioned, since you are already an experienced surgeon, are these treatment available otherwise most of the places, or only few places you say these advanced treatment options are available?
It's very well available here in the UAE. Because these advanced equipments easily come to UAE. So most of the standard hospitals, multi-specialty hospitals,
Right.
all are equipped with this kind of facilities. Yeah.
Okay,
Yeah.
okay. That's very reassuring to know that these treatment options, whether it is day to day or advanced, are easily available in most of the multi-speciality hospital. Now, when I'm sure you encounter this question for almost every patient, whether it is sports injury or any other injury, is there a role of diet in the sports injury, nutrition, hydration? Is there any role? How important are they? Yeah.
Of course, diet, the nutrition and hydration, very, very important for our body, just like it is for most of our activity.
Correct.
Because a well-nourished muscle and a well-hydrated muscle is prone for less injuries compared to
Correct.
a non-hydrated or a muscle which is weaker because of diet, let's say. So diet has to be high protein diet. So especially if you want to strengthen your muscles.
Correct.
And hydration has to be equally good, at least 2.5 liters to 3 liters of water. And when you're playing sports, keep yourself hydrated well all the time. So that is why if you're seeing professionals, they regularly drink breaks.
Correct.
So this is very important, hydration of the muscles. Yeah.
So,
Because a weaker muscle will result in deeper injuries like ligaments and other things.
Right.
The strain is put on the bone and the ligaments.
yeah. So hydration is very important.
Yeah.
Nutrition is important,
Yeah.
especially high protein, because protein will help in building the muscles,
Exactly.
and recovery of the injured muscle will be expedited with this diet or a good hydration.
Yeah.
So, can someone get back to his regular sports, whether it is a professional player or someone who want to play, equally stronger after any injury, or will it cause some sort of a residual effect or residual damage in those muscles or joints in most of the cases?
See, with the advancement in treatment currently, most of them can get back to original level of sports.
Very good.
Yeah,
Very
without any further issues in that. Having said that, all these surgical techniques or this thing and your body limitation will finally determine whether you are able to get back. Of course, with the proper physiotherapy and with the keyhole surgeries, most of them, I would say, will go back to their original level of sports.
Okay, so
Yeah.
that's very, very assuring and satisfying to know that with the advanced treatment option, you can get back to the same activity as you were before, and this is important for the professional players as well as common people like you and me. So, coming to the last question for today's interesting discussion. Dr. Prabhu, what are the golden rules, whether it is 2, 3 golden rules, whatever you want to give to our viewers who are either playing or thinking about playing games, or planning to join a gym for some activities, or for that matter even professional players? What are the rules they should be following to avoid this problem in future?
Well, first and foremost, I would say know your limitation.
Correct.
So everybody cannot become Sachin Tendulkar.
Absolutely.
So know your body limitation.
Correct.
And play accordingly. So try to do things slowly and gradually and try to be there. That's number one. Number two, warm up. Again, I would say warm up, hydrate, and keep yourself fit before you start or resume any sports activity.
Correct. Correct.
Number three, don't be over enthusiastic. Always start slowly, build it up, and then try to become a professional.
Yeah.
Yeah.
So know your limitation, warm up, and try to go slowly before achieving the maximum. So, Dr. Prabhu, thank you very much for answering all these questions in a very simple language. So this brings to the conclusion of this particular interesting episode of sports injuries with Dr. Narendra Prabhu. I would like to thank Dr. Narendra Prabhu for this clear and practical advice which he shared with us for today's episode. Viewers, please understand most of the sports injuries are preventable. As Dr. Prabhu clearly said, know your limitation and go slowly in most of these events. It is observed that you don't go very well prepared for most of these events, and that is the time when the injuries happen maximum. Even if injuries happen, please remember not to ignore those injuries and take the expert's opinion, so that with the correct treatment you will get back stronger in the same game which you wanted to play. So, if you have any questions related to today's discussion or podcast, please do write in the comments. If you want Dr. Prabhu to discuss any other interesting topic related to his field, we will be very happy to welcome that suggestion in the comment. Please like this episode. Please share these episodes who is a gym enthusiast or who is only a weekend warrior, so that he need to understand what precautions he should take, so that all the sports injuries which we just discussed can be prevented in those group of people. Remember, prevention is always better than treatment. So until next time, take care. Thank you, Dr. Prabhu, again for sharing your knowledge with us. Thank you very much.
Thank you, Dr. Amitabh. It's
Thank
my
you.
pleasure to be here. Thank you very much for having me here.
Thank you very
Thank
much.
you.
Good day.